Hi, my name is Dr. John Pack, and with me is Dr. Trajano. We're very excited to share what's going to happen over the next week with you. Dr. Trajano will be having LASIK eye surgery. We decided we'd like to videotape a lot of what happens during the preoperative, during the actual surgery, and during the postoperative stage. That way, you can get an idea, if you have been thinking about this procedure for yourself, what to expect. We're going to give you several installments of these video series. Today's will be specifically about what's involved during the preoperative stage, determining whether or not you're a good candidate, going through some of the tests that we do here at Pack and Bianes Vision to make sure that we get the most accurate data that's then utilized during your surgical procedure. And again, Dr. Trajano is going to share with you some of her thoughts and feelings about what she's going through in this preoperative stage, getting ready for the big day coming up next week. Okay, Dr. Trajano. So Dr. Trajano has been a soft contact lens wearer for many years, but has never worn hard lenses, correct?
Never worn hard lenses.
Okay, and do you have any extreme dry eyes?
Not extreme, but I do have some dry eyes when I do wear contacts, which is why I want to get into LASIK, so I don't have to deal with the dry eyes with contacts.
Okay. And in terms of your prescription, has it been fairly stable over the last few years?
Yes, it probably changed a little bit over the last year, but fairly relatively stable.
So Dr. Trajano is on the high end of nearsightedness. She has a fairly large prescription. We do a thorough evaluation of the front surface of the eye to look for any sign of disease, any sign of extreme dry eye, infections, or any complications that could hinder the surgery. Okay. The instrument I'm currently using is called a corneal topographer. What a corneal topographer does is it takes, you can sit back, it takes a detailed image of the shape of the cornea and allows us to look for any diseases of the cornea, specifically a condition called keratoconus, which is a contraindication for the surgery. The image we just took from Dr. Trajano's cornea is called a corneal topography, and what it does, it gives us a detailed map of the height and elevation differences within her cornea. This is all information that's used during the LASIK procedure, and also information that's valuable to know to make sure that she's a good candidate for the procedure. The next device I'm going to be testing Dr. Trajano on is going to measure the thickness of her cornea. That's a very important measurement because during the process of LASIK, we're actually removing corneal tissue. So depending on how high your prescription is, will vary the amount of cornea that needs to be removed. Place your chin right in there and forehead against the bar, please. There you go, I'm gonna raise you. Okay, very good, and blink, and then hold your blink. Hold, and blink normally now. Thank you. So what we're looking at here is the thickness of Dr. Trajano's cornea, and the thickness varies in different parts of the cornea. Because she has a cornea that's fairly thick, there's not going to be any issue with removing the appropriate amount of tissue in order to perform her LASIK procedure. Okay. Another very important part of the preoperative workup is to make sure that the patient has a healthy retina. Prior to the surgery, we're going to do a thorough dilated retinal evaluation. We're also going to take a retinal scan with the use of an instrument like this called the OptiMap. What this will allow us to do is to get a 200-degree panoramic image of the retina, and we can determine if there's any retinal holes or tears or anything that might make the Lasik procedure a risky procedure. So as part of the preoperative workup, we're going to have Dr. Trajano begin certain treatments to assure ourselves that the surgery has the highest chance for success. One of the areas that we want to be very careful about and to be very cautious about is to make sure that her eyelids and eyelashes are perfectly clean and sterile prior to the procedure. So a week before her surgery, she will begin using a product called Hypochlor, and basically it's a antibacterial solution that she'll use on her eyelids every night for about a week, again to make sure that she has the most sterile surface. She'll also begin using a product called Pro Omega 2000, and what this is, it's a omega-3 fatty acid, and the omegas have been shown to be very beneficial in helping a patient with dryness to the eyes. Because we anticipate a little bit of dryness post-surgical, by prophylactically taking the omegas, we're going to hopefully reduce the incidence of dryness post-surgical. She's also going to be using quite a bit of a product called Oasis Tears. These are artificial tears or natural replacement tears during the both pre and post-operative stage. What this will allow her eyes to do is to heal quicker and allow a smoother and cleaner cornea, which then helps her improve her vision quicker, also helps symptomatically reduce a lot of the dryness that sometimes can occur post-surgically. So again, apart from the antibiotic eye drop and anti-inflammatory eye drop that Dr. Trajano will be using after her surgery, she will continue to use these products as well.